M is for mannitol. Mannitol is used, one of the drugs used for hyperosmolar treatment in patients with traumatic brain injury. It's really preferred by mostly the neurosurgeons. The trauma surgeons tend to prefer hypertonic saline. Really, neither one of them are preferred in the guidelines, and really both of them carry certain risks. Mannitol, though, has to be stored in the pharmacy. It can't be stored in your automated dispensing cabinet because it crystallizes. And so we have to keep it in the pharmacy in a warmed, looks like a refrigerator, but it's a warmer, so a warming fridge, if that's a thing, so that it doesn't crystallize. So we cannot keep it in the dispensing cabinet. Also, it has to be given through a 0.2 micron filter. Nitro tubing is just fine. Otherwise, those crystals that form will find their way to the patient. The patients that we don't want to use it in are patients that are at risk for hypotension. And as you may or may not know, we do allow some permissive hypertension in traumatic brain injury patients. We do that to allow blood flow to continue past where the injury is, and so that the patient can continue to maintain cerebral perfusion despite their injury. And so this hypotension that mannitol causes can be problematic. The reason that trauma surgeons don't prefer mannitol is because in the end, it causes, or its biggest side effect is nephrotoxicity. And so they don't tend to have to deal with the nephrotoxicity, right? They go in, they fix the brain issue, bleed, or swelling or whatever, and they move on. And so they don't have to deal with the nephrotoxicity when it happens a day or two or three or four later. And so they aren't as concerned with that side effect, where your trauma surgeon is going to be very concerned with the potential for nephrotoxicity. And so they are going to prefer hypertonic, or typically 3% sodium chloride. It does have some concerns with raising the sodium too quickly, but it does not have those concerns about nephrotoxicity. And so we just monitor the sodium super close. So that is the story with mannitol. That's why you're going to run to get it out of your Omnicell or your Acudose, your Pyxis, and it's not going to be there because we have it in some kind of little incubator up in the pharmacy. And that's why you think you've got it memorized and you go to get hypertonic, and then your neurosurgeon's like, I want mannitol. Yeah, dosing varies, but it's typically either 50 grams or 1 gram per kilo, and you need a filter. So yeah, there you go. M is for mannitol. Farm ER.